Claudia Jewett, in her book Helping Children Cope with Separation and Loss, discusses the stages of grief a child will go through after the death of a loved one. Keep in mind that developmental psychologists tell us a child begins to conceptualize about age 7. Prior to that, a child will respond to a death in a sensed manner. In other words, the child will imitate the grief response of caregiving adults. That is why every adult should manifest healthy grief responses in front of a child.
Some years ago, I founded a school for the mind and body. Every day I have close to 75 preschoolers running around, and it's wonderful. I do remember asking John about a child whose grandfather had died, and every day he was coming to school very sad. When I questioned the child about how his grandfather died, he didn't know. When I asked him about the funeral, he didn't understand. And when I told him he could be sad and it was okay, he wasn't so sure. Children need to have as many details about the deaths that they are developmentally ready to hear. We need to be truthful with them and not use euphemisms like grandfather expired. We need to give them a secure environment, like their bedroom, when we discuss the death with them. It is very important to let the child express his or her feelings through conversation, play, painting, or drawing. For social support and the ability to recall in the future, it is important to take the child to the funeral and the cemetery. Don't be afraid to let the child tell others about the death. You'll find out how much they really do understand. And always be available to answer questions. Any feeling they express, you should validate.
Let's take a look at Jewett's 8 stages. Stage 1, shock. Children will become very mechanical after a death, much like a robot, just going through the motions. They may sit and gaze into space, punctuated by outbursts of crying and panic. Eventually, they will accept the loss. Stage 2, alarm. Children are about safety and security. When someone in their environment is missing, especially a protector, provider, or playmate, they feel less safe and secure. This may cause physical problems like sweating, dry mouth, fighting, immobilization, bowel and bladder relaxation. Sometimes they cannot sleep or they want to sleep with an adult. Stage 3, disbelief. A child may refuse to believe the loved one is dead. They may close their eyes or put their hands over their ears. All of this points to disbelief. In the child's disbelief, there may be devaluation of the loved one. The child may say, the person wasn't that important to them anyway. Stage 4, hyperactivity. This is an acting out of the child's grief. By keeping busy, the child doesn't have to think or deal with the loss. The child will not want to be left alone.
Stage 5 is yearning. The child really would like a different ending to his real story. The child longs for the loved one to come back. They go back and forth between letting go and holding on. Stage 6 is searching. This is when the child begins to look for the person who died. They have intense thoughts about the person. They go to places where in the past the loved one would have been, and they continually scan their environment with a lot of restlessness and aimlessness, looking for their lost loved one. It is here they usually have strong feelings of sadness, anger, guilt, and shame. Stage 7 is disorganization. The child many times will become passive and withdrawn. There'll be social conflict with family and friends. Frequently, the child will not be responsible with chores and homework and will not complete tasks. School grades will suffer. And finally, stage 8 is reorganization. The child is no longer preoccupied with the loss. Tasks are complete, grades get better, and the ability to attach emotionally becomes real and meaningful again.
If you would like to learn more about children and death, please select one of the options on this page.